Only 3 days left for the UPSC CMS. And it's time to eliminate silly mistakes. Let's see how many of these cardiology traps you can answer correctly. Now, the trap 1. A 50-year-old man comes with a severe chest pain, blood pressure is low, lungs are clear. So, which drug would you avoid giving initially? The correct answer is nitroglycerin. The clue is hypotension with a clear lungs. It suggests right ventricular involvement, and nitroglycerin reduces the preload and causes severe hypotension. Now, the trap 2. A patient has very fast heart rate, blood pressure is low, altered sensorium. What should be your immediate next step? The correct answer is synchronized DC cardioversion. Don't focus only on the rhythm. The patient is hemodynamically unstable and unstable tachyarrhythmias required immediate cardioversion. Now the trap 3. A patient with chronic kidney disease has a dangerous electrolyte abnormality with ECG changes. Which treatment should come first? The correct answer is IV calcium gluconate. The question is testing sequence. First, stabilize the cardiac membrane with the calcium and then lower the potassium. Now the trap 4. A patient suddenly develops severe breathlessness, hypoxic, his blood pressure is very high. What would you start immediately? The correct answer is IV furosemide with nitroglycerin. The priority is to reduce the congestion and preload. Giving intravenous fluids here would worsen the situation. Now the trap 5. One cardiac murmur behaves opposite to almost every other murmur when the preload decreases. Which murmur is it? The correct answer is hypertrophic obstructive cardiomyopathy. Standing and the Valsalva maneuver reduces the preload, increasing outflow obstruction and making the murmur louder. Now trap 6. Students confuse these heart sounds every year. Which one is classically associated with the systolic heart failure? The correct answer is S3, and S3 gallop reflects a volume overload failing ventricle, whereas this S4 associated with the stiff ventricle. Now the trap 7. Look carefully at this ECG shown in the question. Which coronary artery is almost likely involved? The correct answer is left anterior descending artery. ST elevation in V1 to V4 indicates anterior wall microartery infection, most commonly due to LAD occlusion. Now the trap 8. Here is another ECG based question. Which region of the heart is represented by these leads? The correct answer is inferior wall. Lead 2, 3 and AVF represents the inferior wall of the heart. Now the trap 9. A patient suddenly becomes breathlessness, hypotensive and develops a generalized rash immediately after an injection. Which drug should be given first? The correct answer is intramuscular adrenaline. Steroids and antihistamines are supportive, but adrenaline is the first life-saving treatment. Now, the last step, that is 10th one. A patient reaches the emergency department within 2 hours of sudden weakness. Before deciding on definitive treatment, which investigation is absolutely essential? The correct answer is non-contrast CT. Before thrombolysis, intracranial hemorrhage must be excluded, and that's exactly why a non-contrast CT is mandatory. So, how many did you score out of 10? These weren't difficult questions. They were the easy questions that become wrong because we rush under the exam pressure. Save this video, share it with your CMS study partner, and I'll see you tomorrow with another CMS post. All the best for your exam.